doing what we're...
Now, okay. Can you please state your name for me?
I'm Sarah Mendlovitz.
Okay, Sarah. What surgery did Dr. Wilson perform for you?
He did a total knee replacement.
A total knee. Can you tell me about your experience with Dr. Wilson, please?
I think he's fantastic. I think he's probably the best orthopedist in New York.
Okay.
He is thoughtful, he's attentive, he's very progressive in the way he handles surgery and patients. And I recovered very, very well and completely. The only problem I sometimes have is a bit of pain when I go upstairs.
Mm-hmm.
But it certainly was a remarkably successful surgery, and I thank him every day for having done it.
Okay. How did you feel before the surgery?
I felt terribly frustrated. Mm-hmm. We had lived in Portland, Oregon for 12 years, and while we lived there, I had a doctor who did 2 arthroscopic surgeries on both knees to clean them out, but it didn't really make a big difference.
Mm-hmm.
But nobody was willing to entertain the idea of a knee replacement. When we came to New York, I had been taking some classes on the Upper East Side, which required me to carry books on the subway,
Mm-hmm.
and I didn't have any trouble with that, but my knee just gave out. So it was very hampering, very limiting, and a lot of pain.
Okay. Do you remember what you were unable to do before the surgery? Were there certain things you couldn't do that your knee inhibited you from doing? Like you said you had trouble walking up the stairs, or it was just discomfort?
No, I had trouble walking up the stairs and walking in general.
Walking in general. Okay.
It was very painful.
Mm-hmm.
And I sort of didn't want to do much because it was so painful.
And how do you feel now that you've had this surgery?
I feel terrific, and it's been 10 years.
Oh wow, that's good.
And it really, really has lasted very well. And I still have some pain walking upstairs, but it's nothing compared to what it was before that.
Okay. And what can you do now that you couldn't do before the surgery? Do you walk better in general?
I walk better in general,
Mm-hmm.
And I have some other things going on that complicate my life a bit. But
Mm-hmm.
the knee does very well for me, it really does.
Okay. Do you have any regrets about the surgery?
No.
No. Okay. Do you wish that you had made the decision sooner than you did?
I had tried to make the decision sooner, but in Portland, Oregon,
Mm-hmm.
the people who were the orthopedists just were not prepared to do it.
Okay.
And so when I found Dr. Wilson after having a really hard time on the subway and the stairs and all that, it was just such a relief and such a blessing.
Okay. Is there anything that you would tell a patient in your position that was considering this surgery?
I would find out all I could about whoever I was thinking of having doing it.
Mm-hmm.
I think you can check out Dr. Wilson from here till tomorrow, and his credentials are outstanding. He also has done some rotator cuff surgery for me on my shoulder, and instead of being in a sling for 6 weeks, I was out of it in 2 weeks.
Oh wow, that's
And
great.
the recovery has been remarkable, and that was his choice, not mine necessarily. But I think he's a really gifted surgeon, and I think that you can trust him. If he doesn't think it's the right thing for you, he will tell you. But I trust him very much because I have found him to be honest, and I have found him to be helpful, and I have found him to be a good buddy.
Okay. Thank you so much.